Hi, it's Naresh the orthodontist. Patients often ask how they can floss with fixed braces. There are lots of ways to floss, but most of them require a degree of dexterity, not the sort of agility that you want to perform bleary-eyed first thing in the morning or when you're exhausted last thing at night. One of the biggest challenges with braces is food and plaque can collect around the brackets, under wires and between the teeth. Brushing is really important, but brushing alone will not clean your teeth properly. This type of brace flosser is helpful because the thin, flat arm is designed to slide behind the brace wire, so you don't have to struggle with threading normal floss through each contact. Here's how to use it. Firstly, use the flosser gently and slide the flat side carefully under the brace wire. Then guide the floss between the teeth. Do not force this. Once it's between the teeth, move it gently up and down against the sides of each tooth, taking it slightly under the gum line. Then remove it carefully, rinse and move to the next space. You can also use the soft pick end to remove any food caught around the brackets and the wires, especially after meals. Some important tips. Be gentle. If you snap the floss down too hard, you will hurt your gums. Do not use it to pull or bend the brace wires. That would be our job. If your gums bleed a little at first, this can happen when plaque is built up, but with regular cleaning, this should usually improve. If bleeding continues, or you have pain, swelling, or loose brackets, please contact the orthodontic team. For best results, try and clean between the teeth every day, especially before bed. It only takes a few minutes, but it can help make a big difference to keeping your gums healthy, your breath fresh, and your brace treatment on track. So, brush carefully, floss daily, and keep those braces clean. Thank you.